So, coccyx pain and the causes and the solution. That's the subject of this video. Your coccyx is your tailbone. And unlike what a lot of times you hear, unfortunately, it does have a purpose. So removing the coccyx to address an unsolved coccyx or tailbone pain is absolutely disastrous in my opinion. Your coccyx, as you can see in this model, all these white things are different ligaments that are attached to it. It's like the tip of a tent when you're pitching a tent. That piece of wood that you put there to hold this up is your coccyx. So why would you have coccyx pain? Who knows what you're doing? Are you sitting on your tailbone or are you sitting on your sit bone? Are you moving in such fashion that you have so much instability in your sacroiliac joint, your SI joint, that the two halves are just not working together? So one side is pulling more than the other, one side is rotating more than the other, one side is side bending more than the other, because those are all variations that can happen. It pulls on those ligaments, it causes tension on the muscles on the inside of your pelvis. You have other presentations that come with a package of pelvic floor dysfunction, and then you're wondering what happened. Many times we are distracted when it comes to the world of treating pelvic floor dysfunction. We are so distracted attending to the muscle tone or muscle strength inside the pelvis that we don't follow all the way to the coccyx or tailbone to begin with. Getting injection does not necessarily take care of the actual cause of your pain to begin with. So why do you have it? There are a lot of different things that can cause it, but what causes that pain is a dysfunction in patterns of movement. It's the yanking and pulling that is happening on this poor little area that is causing an issue. What does the treatment look like? The treatment, from my perspective and how I treat patients, I look for dysfunctional patterns of movement. I look to see how this patient is moving, how is this patient utilizing their body parts in action. In other words, are you following the principles of movement or are you not? That's kind of like a car. If the car keeps getting banged up, you question the driver. You question if the driver understands the principles of driving. If the principles are not understood or followed, well, then damage does happen. What does the treatment look like? We remove the things that are dysfunctional, replace them with the principles and with the mechanics that are more in tune with the body's movement. And that nutritionally speaking, in general, when it comes to soft tissue, we address, basically I recommend vitamin C, I recommend protein for tissue healing, collagen, vitamin D. These are all great things to have. And then we work on ergonomics, because how you sit all day is playing a role. We're looking at lifestyle, because how you move around and do things impact it. So it's a global and holistic approach to solving this issue. If you were looking for that one magical exercise that was going to make your tailbone pain go away, there is none. It's global. It's more than one thing that you should be doing. I hope this makes sense. If it doesn't, contact me, let me know why you think it doesn't. And if you have not subscribed to the channel, this is your opportunity to do so. Until next time, take care.